Welcome to Caregiver Chats. Today, I'm talking about the impact that caregiving can have on finances. So stay tuned and we'll get into it. Hi, Dr. Lakelyn here. I'm a gerontologist and caregiving advocate for Home Instead, an honor company. Today on the Caregiver Chats podcast, I'm going to talk about the financial impact of caregiving. It's not always easy to talk about money, but I recently spoke on a panel and had the opportunity to share about caregiving and how it relates to financial well-being. It inspired me to share some of what I covered with you today. So here's what we're going to dig into. First, I'm going to talk briefly about the financial impact of caregiving. Then I want to talk about the importance of having a conversation about finances for the person you're caring for and the need to plan ahead. And as part of this, I'm going to touch on options to pay for care because it's something I get asked about a lot. Then I'll wrap up with some considerations for caregivers' personal finances and some helpful resources. As I go through all of this information, please know that these are suggestions on things to think about. I recognize everyone's personal financial situation is different. So I would encourage you to seek guidance from a financial professional to help you navigate your unique situation. All right, let's get into it. We'll start with the financial impact of caregiving. Many of you are likely feeling the strain on your finances as it relates to your caregiving role. According to AARP's Caregiving Out-of-Pocket Costs study, the typical annual total spent by caregivers is over $7,000. In fact, it's $7,242 on average that a caregiver spends out of pocket each year. This is about 26% of a family's income on average. This amount is substantial, but it can be even more depending on various factors, such as the level of care that's needed, the geographic location, and additional expenses like medications or medical equipment. A long-distance caregiver shared with me that she traveled several hours by car every weekend and booked a hotel room so that she could visit her mom in the care community in the town that she grew up in. She said the cost for travel on top of what they were paying for the care community was creating a huge financial strain. She was getting close to having to dip into her own retirement savings to pay for her mom's care. And I know many caregivers out there are having similar experiences. And while this is a common challenge, many families are waiting until a crisis to talk about finances and have the conversation. And during this time, during a crisis, it can be very stressful. Caregivers and family members may be unsure of what their aging loved one can afford, or if they have a long-term care insurance policy. And they may realize that their loved one needs to apply for a program like Medicaid, but are surprised to learn that there's a waiting list for services. We also see in aging couples where one spouse is commonly in charge of the finances. In many cases, it's the husband. But when he passes away, the wife is suddenly in charge of all of the finances for the household for the first time. And she can become easily overwhelmed and may not know where to begin. And in these situations, the adult children or other family members often have to step in to support. That's why it's so important to start talking well in advance of a crisis or a death in the family about finances. And it's not just a financial discussion about the funeral costs. People are interestingly comfortable planning for their funerals, but not the care that they might need in the years or months leading up to their death. And that's the last thing we want to be talking about during a crisis or those tender end-of-life moments. We don't want to be talking about money. So let's talk about it early. But no matter when you bring it up, I realize it can be an uncomfortable conversation to have. And an older adult might be resistant to talking about it or embarrassed to talk about their financial situation. However, if we can approach it with curiosity, empathy, and from a perspective of empowering the older adult, we may find they're more willing to have the discussion. You could also frame it up as a joint financial planning session, which could help make it feel like everyone is playing a vital role. So let's talk more about planning ahead from a financial perspective. First and foremost, I'm going to say this a lot, but start the conversation early. Discuss long-term care plans and financial matters with your loved one before the needs arise. And again, this can help alleviate stress and make sure that everyone is on the same page. And keep in mind that this is not a one and done conversation. You're going to need to revisit this conversation somewhat regularly, especially if there's a major event such as a health diagnosis or death of a spouse. The first important point of discussion is designating a financial power of attorney. You want to make sure that there's a formal document in place. And you want to make sure that the person that is designated as the POA, power of attorney, is notified, and then that document is easily accessible when it's needed. And a financial POA is someone that can make financial decisions or, pay bills when a person is unable to do so. Next, you should consider creating a system to identify and document all of the accounts, insurance policies, and financial contacts for your older loved one. People often have multiple bank accounts or investment accounts. And today, we're also encouraged to go paperless with these statements, so you're no longer getting those statements in the mail. And that can make it challenging to know what accounts there are, and then also to know any passwords associated with online accounts. In addition to those financial accounts, also determine if there are any policies, such as long-term care insurance or life insurance. Sometimes people have been paying premiums for so long on these policies that they almost forget about them. But it's important to understand if there are any policies, and if so, what they cover, especially in those long-term care policies. Also ensure that the beneficiaries on those accounts are current. And then it can be helpful to know if there are any specific individuals that your loved one works with, such as a banker, financial advisor, or estate planning attorney. If so, compile their contact information. And speaking of professionals, another tip that I have is for these discussions, bring in professionals. Those financial planners, estate planning attorneys, or other elder care specialists can offer personalized guidance that's tailored to your unique situation, and they can help you make informed decisions about long-term care financing. And then the final part of this conversation can involve exploring all of the available resources and ways to pay for care. From community-based services to government assistance programs, there might be options available to help offset some of these caregiving costs, and there might also be misconceptions about what is and is not covered. But before we dive further into these care options and the costs, let's take a moment to hear from our sponsor. This podcast is brought to you by Home Instead, an honor company. If you find yourself needing extra support as a family caregiver or time away from your caregiving responsibilities, Home Instead can help. Our home care services are delivered by compassionate care professionals and range from personal care, meal preparation, and medication management to Alzheimer's care and hospice support. Visit homeinstead.com to learn more and to find a location near you. I want to talk more about the options to pay for care. Unfortunately, we don't have a crystal ball and we can't predict the future. So the true cost of future care really is unknown. We don't know exactly the type of care that will be needed, but what we do know is that at some point, 70% of people over the age of 65 will need some type of long-term care. And in case you're wondering, long-term care includes a variety of services. These can be services such as care in the home, like home care that we provide at Home Instead, or home health care. It can also include care in a community setting, like adult day centers, independent living, assisted living, memory care, or nursing home level skilled care. And while there are a lot of unknowns around what kind of care will be needed and when, families can start to research and understand the potential costs and ways to pay for this care. One misconception people often have is that Social Security, Medicare, and a person's retirement account will completely cover the cost of care. But the truth is, Social Security does not have a care benefit, and Medicare only pays for a limited amount of long-term care under very specific circumstances. Also, since people are living longer, some are finding that their personal savings or retirement accounts are running out or won't have enough funds to cover the costs of the services that they're going to need. If you're hearing this information for the first time, it could be overwhelming, so I'm sorry. But I'm glad you're here. I'm glad you're learning about it because it's important to start planning ahead. You still have time to look into these options. And so I'm going to now share some more information and resources that can hopefully help get you started. One helpful resource is the Cost of Care report that's put out by a company called Genworth. The link is in the show notes, but you can also Google Genworth Cost of Care Study. On the Genworth site, I really like this site because you can do a search by city, state, or zip code to find the estimated costs of care in your area. I would encourage you to go check that out. Another helpful resource is a funding solutions guide on our Home Instead website, and you can download it for free. I've linked to it in the show notes as well. The guide shares various funding options for care. It first talks about how the most common form of payment for long-term care in the U.S. is self-insurance, which is just a fancy way of saying private pay or paying out of pocket. And this is where a person's personal savings comes into play. Sometimes the adult children can also contribute with their own money to cover the costs of care for their parent. Another payment option that some people have access to is long-term care insurance. You've heard me reference that a few times already. These are often policies that an older adult has been paying on for many years. And each plan is unique to the person that has the policy, so you need to read it carefully and often call and ask clarifying questions to understand what the policy covers. I've linked to another helpful guide in the show notes with information and important questions to ask about long-term care insurance so that when you call, you're better informed. Next, I want to clarify the difference between Medicare and Medicaid, as these programs can be confusing. Both are government programs. And Medicare is essentially a health insurance for people who are 65 and older, and it is also the same for some younger individuals with disabilities. It helps cover things like doctor's visits, hospital stays, and some prescription drugs. Medicare may cover some long-term care after a hospital stay, like home health care or a short-term stay in a rehab facility. But that amount of care is usually for a short period of time. Some individuals may opt for additional coverage called Medicare Advantage. Some Medicare Advantage plans, or you might hear it called Medicare Part C, offer a bundle of benefits. And this bundle could include some care and support. But each plan is different, so it's important to know what your loved one's Medicare Advantage plan covers. Medicaid, on the other hand, while it's also a government program, it helps people with low income and limited resources. Each state in the U.S. manages its own Medicaid program within federal guidelines, so it's really important to understand the program specific to the state that your loved one lives in. It's also important to know that some programs have waiting lists for support services in the home. Medicaid may also cover the cost of nursing home or community care, but there's often what's called a spend down that's involved that requires you to use personal assets first before Medicaid kicks in. I'm the first to admit Medicaid can be very complex to navigate, so it's really helpful to work with an elder care attorney or someone that has experience in working with Medicaid. Also, keep in mind that not all care providers or care communities take Medicaid, so the options for care may be more limited. One final source of payment for long-term care that I want to cover today is Veterans Assistance, or the VA. 1 in 3 older adults in the U.S. is a veteran or a surviving spouse of a veteran. Veterans and their surviving spouses may be eligible for a VA benefit called Pension with Aid and Attendance. This benefit may provide reimbursement for caregiving-related expenses, so you can contact your local VA to see if the person you are caring for qualifies. Funding for long-term care may feel like putting together pieces of a puzzle or weaving together patches on a quilt. But hopefully by looking into various options for payment early on, it can help you uncover various funding options that can help to ease some of the financial burden. Now, if you're listening and thinking, Dr. Lakelyn, I need help right now. I need to figure out some things related to finances. There are 2 things that I would encourage you to do if you don't kind of have the luxury of time to plan ahead. First, I would contact your local area agency on aging, and I'll put a link in the show notes where you can search for that by zip code. But often your AAA, as we call them, have a really good pulse on what is available in the community that you live in that relates to finances and financial assistance. Also, if your loved one is in the hospital and you're headed home from the hospital or headed home from a rehab facility, there's often a social worker that you can contact that also has information and resources that can relate to your finances. I hope that these resources are helpful and can give you a few first steps. Finally, let's talk about the impact of caregiving on personal finances. Many caregivers often find themselves juggling their own financial responsibilities alongside the costs associated with caregiving. And watching your loved one go through the process of finding and paying for care may also get you thinking about your own future care and financial needs. Here are some tips to help you, the caregiver, think about your personal finances both now and in the future. So first, think about a budget. You might want to sit down and create a budget that covers both caregiving expenses and your own needs. This can help you get a handle on how much you're spending on caregiving and other expenses. It can also help you identify opportunities to save for your future. Next, look into programs or benefits that can help ease the financial strain. I mentioned several ways earlier to pay for care, but you can also see if there are any available tax credits in your state or if your state has programs that pay family members to provide care. Also, don't forget about the power of community support. Some local groups or nonprofits have financial aid, grants for care, or programs that can offer guidance on financial resources. You can also consider having a heart-to-heart with your family about caregiving responsibilities and the financial side of things. Pooling resources with fellow family members and sharing duties can make a big difference. It's important to think about today, but it's also important to plan for the long haul. Planning for your own retirement and looking into insurance options for yourself could help to take some of the weight off your shoulders down the road. Also, if you are working, explore any benefits your organization has that could help you as a caregiver. Whether it's their EAP benefits, which stands for Employee Assistance Program benefits, or maybe they have an employee resource group on caregiving, or can offer you flexible scheduling. If you're feeling the need to make adjustments to your work schedule due to caregiving, consider how that will impact not only your take-home pay, but also the opportunity to save for your retirement, such as contributing to a 401k. And if you have to exit the workforce or cut back to part-time, consider working with a financial planner to determine ways you can still save for your future. Also, stay in the loop. Stay informed on changes in policy or new resources for caregivers that can help you stay ahead of the game when it comes to managing finances while caregiving. A great organization to follow is the National Alliance for Caregiving. They're working on advocacy efforts to support family caregivers, and their website is caregiving.org. Another helpful resource produced by an organization called Wiser is the Financial Caregiving Hub. This online hub has helpful tools and information to help you with budgeting and looking into resources. I linked to it in the show notes. You can also find it at wiserwomen.org. Finally, remember that you're important too. Keeping yourself healthy, both physically and mentally, can prevent any unexpected financial hits from medical bills. Also, if you're stressed about your finances, try to find ways to de-stress, whether it's journaling, meditating, working out, or spending time outdoors. It can do wonders for your mental well-being. I hope that these tips and resources can help you as you work through your personal finances as a caregiver. As we wrap up today's episode, family caregiving for an aging loved one can present numerous financial challenges. But with careful planning and proactive measures, it's possible to navigate this terrain with confidence. Remember, you're not alone in this journey. There are resources available to support you every step of the way. And I would love to hear about your caregiving stories and any tips you have on the financial aspects of caregiving. You can email me at caregiverchats@homeinsteadinc.com. That's caregiverchats@homeinsteadinc.com. In the next episode of Caregiver Chats, I'm going to talk with author and aging expert Maddie Dykewald about how caregivers can take ownership of their own aging journey. We'll explore how embracing aging can help you overcome societal biases and prioritize your own self-care. I hope that you will tune in. I also invite you to follow us on Facebook at Home Instead Inc. That's Home Instead INC for previews of upcoming episodes, caregiving tips, and more. You can find all the links in today's show notes. Thank you for listening, and please remember to take good care of yourself while you care for others. Caregiver Chats is brought to you by Home Instead. If you're looking for in-home care to support you on your caregiving journey, please visit homeinstead.com to learn more.